Hello, my name is Dr. Michael Metyk, and I'm here to discuss with you a new technology called laser-assisted PRP therapy. We have found this new therapy to be very effective for the following conditions: neuropathy, arthritis of the knee and feet, foot pain, soft tissue injuries, and shoulder injuries. Most of you who are watching this film today are probably on multiple medications, and that is utilized pills and tablets to treat your condition today. But the future of medicine is moving towards technologies that harness your own body's capability of healing, such as laser-assisted PRP therapy, stem cell therapy, and gene editing therapy. Those are all technologies of the future, and some of them are even here today, such as PRP laser-assisted therapy. PRP laser-assisted therapy is composed of two components. First, the PRP and the laser component. The PRP is called platelet-rich plasma. Your blood is drawn, and we isolate the chemicals that allow your body to heal, along with platelets, which are cells in your bloodstream. Once those are isolated, they're then injected into the area that needs to be treated. Now, we have found this to be effective in isolation, but when combined with laser therapy, we get even a better result than we would if we use PRP alone. The laser therapy is used in combination with the PRP. We suggest 1 to 3 treatments of PRP therapy combined with 6 to 10 treatments of laser therapy. That schedule we found to be very effective. The initial PRP injection can be given and then re-given again a month or 2 later if needed, but many patients only require 1 or 2 injections over 6 months. And then the laser therapy is added on top of that over a 6 to 10 day period of time.
I go by Woody, but my name's actually William Wooddeal. I had a primary care physician, I'm not going to say their name. They kept trying to push different drugs on me that had bad effects, and they weren't really seem to be concerned about me and my welfare. And that kind of turned me off, and that's why I was looking for another doctor. Now, I came to Dr. Mike because I had a specific problem, and he was a podiatrist. What happened is my big toe developed a problem, and it became infected and it got into the bone, and I was in danger of losing my foot. But Dr. Mike did a great job. I'm now able to walk around and I'm just fine and dandy. The staff has always been very friendly. Mike has always shown a great deal of concern because I was infected and there was danger of it spreading and becoming a problem. And he always showed a whole bunch of caring attitude.
My name is Sherry Spencer. I had a toenail and it was swollen and like it was infected, and about 3 times its size. Dr. Metyk knew exactly what was wrong with me. He's been working with me since then to make sure everything is working the way it's supposed to in my foot, and I'm able to walk. So just recently I've been able to walk without pain. Dr. Mike is fantastic. He's friendly, he's caring, and he goes out of his way to make sure you have what you need. I love everybody in here. All of the girls that work in here, they're really super nice and make sure that I'm taken care of. I've never been to anyone else. I wouldn't go to anybody else. I really like how he is with me.
My name is Elizabeth Dobak, and I am a patient of Dr. Michael Metyk, and I can recommend him to everybody who has a pain because I really had a very positive experience. Michael Metyk takes me in right away, diagnoses what it is, and take care of the pain. I'm very, very pleased and very happy that I know him because my husband comes here too, and he's our wonderful doctor.
My name is Bela Dobak. I came from Europe for 8 years, and I can recommend Dr. Metyk to everybody. He's almost like a family type of guy, you know. My experience with him and the whole staff was good. I feel good, you know, his injection and all this stuff make me feel good. And I will stay with him.
My name is Kimberly Seguero and I'm a certified medical assistant here. Dr. Mike is a really great doctor. He's smart, he's really kind, he really cares about his patient. He has lots of experience in the podiatrist field. As I see patients walk in and out of these offices today, they say how my feet feel so much better, how the shoes work, how he always gets them in at the same day, same time.
So to summarize, new laser technology called laser-assisted PRP therapy. If you have peripheral neuropathy, arthritis of the knees or feet, please feel free to give us a call at 941-613-1919, or you can obtain additional information at prplaser.com.